Constipation. As we get older, it's common to have fewer bowel movements, take more time to pass stools, or notice that your stools are hard or lumpy. These signs may mean you're constipated. Learn what constipation is, how to prevent it, and when it's time to talk to a doctor. Worried about constipation? Constipation can make you feel uncomfortable or uneasy. If you're not going to the bathroom as often, it takes longer to go, or your stools are hard, you might be dealing with constipation. Almost everyone gets constipated at some point, but it's more common in older adults. In fact, about 1 out of 3 older people sometimes experience it. The good news is that constipation usually isn't serious and can be treated. Signs of constipation. Some people think they're constipated if they don't have a bowel movement every day, but that's not always true. Everyone's body is different. Some people go twice a day while others go only 3 times a week, and that can still be normal. But if you often have trouble going, you might be constipated. Common signs include fewer than 3 bowel movements a week, trouble or straining when trying to pass stools, hard or lumpy stools, feeling like something is blocking you or that you haven't completely finished. What causes constipation? There are many reasons why older adults may get constipated. Health problems, medicines, and even changes in daily habits can all play a part. Health problems. Some medical issues can slow down how your bowels work. These include problems with the muscles or nerves that help you go to the bathroom, such as after a stroke, with Parkinson's disease, or a spinal cord injury. Hormone or metabolism problems like diabetes. Other health conditions such as blockages, tumors, pelvic muscle issues, or digestive disorders like irritable bowel syndrome, IBS. Changes in eating and activity levels due to surgeries or health treatments. Diseases like Alzheimer's or other forms of dementia, which affect eating habits and daily routines, can also increase the chances of constipation. Medicines and supplements. Some medications, whether from your doctor or bought at a store, can cause constipation. These include medicines for depression, antacids with aluminum or calcium, allergy drugs, antihistamines, pain relievers, blood pressure medicines, diuretics, water pills, drugs for Parkinson's disease, muscle relaxers and seizure medicines. Some supplements like iron, even anesthesia used during surgeries can slow down your bowels temporarily. Food, water, movement, and routine. Your diet, how much you drink, and your level of activity also affect your bowel movements. Here are a few common causes. Not enough fiber. If you don't eat enough fruits, vegetables, or whole grains, you may become constipated. Eating too much fatty meat, cheese, eggs, sugary snacks, or processed foods can also make things worse. Not drinking enough water. Fluids help your body move waste through your system. Without enough water, stools can become hard and harder to pass. Lack of movement. Not being active enough or being stuck in bed after being sick or having surgery can slow things down. Changes in daily routine. Traveling or changes to your normal schedule can also lead to constipation. How to treat constipation. Most of the time, constipation can be managed at home with a few simple changes. Here are some tips to help make your stools softer, easier to pass, and to stop constipation from happening again. Eat healthy foods. Try to eat plenty of fiber every day. Good sources include fresh fruits and vegetables, cooked or raw, whole grain bread, and cereals. Drink enough fluids. Not drinking enough water can make constipation worse. Be sure to drink plenty of water, juice, or other fluids throughout the day to help keep things moving. Keep moving. Physical activity helps your bowels work better. Try going for daily walks or doing any activity you enjoy that keeps you moving. You can also try over-the-counter products like fiber supplements or stool softeners. These can help with constipation. Your doctor or healthcare provider can help you choose the best one for you. If these steps don't help, or if you have pain, bleeding, or other serious symptoms, you should see a doctor. The doctor might suggest changing your diet or exercise habits, giving you a supplement or medication to help you go to the bathroom, a treatment called biofeedback, which uses special devices and coaching to help you learn how to use your muscles better. In rare cases, surgery may be needed, especially if there's a blockage or if the colon muscles aren't working properly. If surgery is suggested, your doctor will talk to you about the risks and benefits. When to see a doctor. Constipation is usually not serious, but sometimes it can be a sign of a more serious health problem, like cancer of the colon. Call your doctor if your bowel habits change and you also have blood in your stool or bleeding from the rectum, bad stomach pain or trouble passing gas, vomiting or a fever, weight loss without trying, lower back pain, no improvement after trying more fiber and exercise.